Hi everybody, I'd like to introduce you to Dr. Donald Ozello of Championship Chiropractic.
Thank you.
And I'm James Wong. I've been running health and wellness events in Las Vegas for the last 8 years, and Championship Chiropractic has been part of every event I've done. I love what Dr. Ozello is doing. Today we're talking all about spine health, and in particular, we're talking about what's cervical retraction.
Cervical retraction is a motion that we perform for the neck. First of all, the cervical spine is the medical terminology for the neck. We have different motions in the neck. We have flexion when we bend the chin forward, extension when we're going backwards. There's left lateral flexion, right lateral flexion, left rotation, and right rotation. Now, retraction is moving the spine directly backwards. And this is so important because many times when people have poor posture, the spine is forward. It's called a forward head posture or forward head carriage, and it puts a great deal amount of stress on the structures in the spine. So retraction is a motion that you can perform, a strengthening exercise that's going to help to strengthen the muscles in the back part of the neck that is going to allow us to stay in a better posture.
So it's important to keep up cervical retraction. What are some of the movements that you recommend?
Well, the basic movement is performed. Obviously, you're sitting in good posture, and you want to have the thoracic spine, which is the mid-back, in good posture. You want to have the shoulder blades back, and then you are just moving the neck backwards, and you are holding this position. It's an isometric contraction. You start with a 2-second hold, and then you build to a 6-second hold. And just like in any other exercise, you always want to work through a symptom-free range of motion. Even if that motion is minuscule, you want to work through a symptom-free range of motion. An exercise should never elicit symptoms or intensify symptoms. If it does, you want to stop immediately. But with cervical traction, you are sitting in good posture, and like I said, you have the thoracic spine straight, you have the shoulder blades retracted, and you're going to move the neck straight backwards. And you're going to hold this position for 2 to 6 seconds.
And why isometric?
Well, the isometric is important because it builds endurance. That's why the isometric is so important. We think about many times people are on their phones in this position, or they're working on a computer and they move closer to the screen, so they're sitting in a poor posture. So when we do the isometric, it builds strength and it builds endurance. So that's why the isometric is so important, because it allows us to stay in a better posture for a longer amount of time.
And can it help me function better and actually help prevent injury?
Of course, yes. Yeah, that's an excellent question. When you are doing cervical retraction, we build strength in the muscles in the posterior part of the neck. That will help, first of all, to make us move better. Because many times when the muscles in the front part of the neck are stronger than the muscles in the back part of the neck, when someone turns their head instead of doing this, or when someone bends their head instead of doing this, they will do this. So having strong muscles in the back part of the neck allows us to move better, allows us to function better. And when we are moving better and functioning better, holds us in a better position, and it helps to prevent injuries.
That's great. Thanks, Dr. Ozello.
Thank you, James. I appreciate it. Thank you, everybody, for watching today's video on spine health. If you have questions, feedback, or suggestions, you can leave them in the comment section below. Please feel free to like this video, and please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. You can also visit my website, championshipchiropractic.com, where you can see my blog, which contains articles on sports medicine, chiropractic, health, fitness, and nutrition. Thanks again for watching today's video.